Welcome to episode 6 of Let the Adventure Begin, and today we are in person, which is lovely. We are coming to you live from the Center for Women's and Children's Health here on the Newark campus of ChristianaCare. We are coming to you from the Ronald McDonald Room, which is one of the awesome new additions here at the Center for Women's and Children's Health. As you may have figured out from the props we were able to bring today, we are talking about packing your hospital bag, and we have brought Laurie Littleton here with us, the Vice President of Patient Experience. Laurie, please correct your title for me and introduce yourself.
Hi, I'm Laurie Littleton. I'm the Vice President of Patient Care Services. My scope is over the Center for Women and Children's Health, which includes our OB emergency department, our labor and delivery, of course. We have an antepartum unit, a high-risk unit, our pediatric unit, neonatal ICU, as well as our postpartum unit, which is probably where most people will stay after delivery to kind of bond with their baby and all that good stuff. So, and as well as our parent education team and lactation consultants.
Fantastic. So you'll be able to answer all of the
I'm
questions
hoping.
today.
I'm hoping.
So if you are like me, and I am 35 weeks, so it is time to start getting my things together. So I've brought a few of my things for this conversation. If you have any questions about what to pack in your hospital bag, what comes from the hospital, which we'll also get to today, or any other questions from Laurie, since obviously she is well-versed in all things Center for Women's and Children's Health, please submit those in the comments below, and our producer Karen will send those over to me, and we'll be able to answer your questions as well. So, Laurie, let's get started with Bag for Mom.
Okay. Bag for Mom. First of all, we recommend you pack about 3 to 4 weeks in advance.
Okay.
Honestly, preparation will help most be less anxious about the arrival of their little ones. Mm-hmm. So packing it early, of course, is fine, but we do recommend 3 to 4 weeks before your official due date. For mom, we have absolutely everything that you need here. We recommend that you come with any comfort items that you really require or that will make you feel better. And I made notes, so pardon me, I'm going to look down at my notes because we interviewed some staff members and nurses in the building, as well as some patients prior, and even some patients who are getting ready to come and curious about what they want to bring, which is perfect for the people that we're talking to now. So obviously we want you to bring things comfortable. We want you to bring loose-fitting clothing or pajamas, something
have
that,
my pajamas.
yeah, perfect.
I have my slippers.
Right, a robe, socks and slippers is great. We have no-slip socks, which we provide. We also recommend a supportive bra, a nursing bra, if that's what you prefer. Lately, we've gotten a lot of requests for pants, which is something we will be working on supplying more of. But if that's something that you prefer, we suggest you bring along with you.
Okay.
What else? Toiletries, anything that you require, lotions, potions, all of that great stuff. Again, we have soap, we have shampoo, conditioner, lotions, anything that you would need, toothbrushes and toothpaste, but any of your personal items, obviously, we welcome you to bring. Hair ties, hair clips. That was another great suggestion by one of the nurses because sometimes that's forgotten, and we try to provide. Entertainment items, obviously cameras, music if that's what you prefer, headphones, and chargers. Chargers are super important.
Long cord chargers? What is the plug-in situation?
The longer cord, the better. Okay. But we have outlets right next to the bed and plenty around the room in this new suite that you'll have plenty of places to put your chargers. Essentially, we have absolutely everything that you need. We just encourage any comfort items.
And Wi-Fi in the rooms.
Wi-Fi in the rooms, yeah.
Fantastic.
Yeah.
So let's move on a little bit to then what you pack for baby. Do you recommend bringing the diaper bag with the things for the baby?
Again, we have everything that you need, but we recommend you bring a take-home outfit, as you have here. These are so cute. Look at the little...
2 of those.
Yeah, 2 of those. Some would recommend a newborn and a 0 to 3 months, depending on how big your baby is, but most babies generally fit in the newborn size. Again, that's simply your preference. Anything, socks, booties, anything that goes with that outfit. The most important thing to remember for baby is a rear-facing car seat, which we do need you to bring. That's super important, and we do recommend that you bring it at least a day before your discharge.
Okay.
so we can make sure that all of the safety checks are done and you know how to use it and that baby fits in it properly.
And how does all of that work? Checking that the baby actually fits in it properly.
We'll help you. Yep, we'll help you. We'll help you make sure that the baby fits snug, and that all of the attachments are where they need to be. Because every car seat's a little different, so it's hard for me to speak to exactly what you need to do, but we'll help you with that. We have the experts in our parent education team that can certainly provide a consult if things are more complicated.
Fantastic.
Yep.
So then, as you've been saying, you have everything that we need.
Right.
So what do we have here? What does come in the room?
One other thing I did forget to mention when you said diaper bag, any keepsake items, baby books that you want to bring, obviously bring that stuff as well. What we give you, is that what you're wondering? Like what we provide? Okay, so we provide any needed or medical or comfort items. Things like diapers and wipes, obviously. Anything that's left in your room at the end of your stay, you're welcome to take with you.
Okay.
We provide things for mom like peri pads, obviously, ice packs, witch hazel pads, some of the cooling, numbing spray. What else? Mesh panties if that's necessary. If you want to bring your own, kind of bigger maternity underwear that's comfortable, you can do that as well. Abdominal binders we'll provide for any of our C-section moms, which are normally make you feel a little better, comfortable. What else? For the little one, the diapers and wipes, anything that's left in the room as far as formula. We'll provide a pacifier if needed. We normally use that as a calming strategy for any uncomfortable procedures like a C-section, a circumcision. We have hats. We have the little hats.
It's so little. It's so little.
Look how tiny it is. It fits in my fist. And undershirts.
Okay.
These little undershirts that we use. We don't use snap in the kind of crotch onesies because they're harder. More for mom, anything you would need for breastfeeding, if that's your preference.
Okay.
Creams, nipple shields, things like that. We have peri bottles.
And then would you recommend we bring the nursing pillows with us?
So, we do supply and we can give you, while you're here, some of the feeding pillows. We have plenty of regular pillows as well to kind of make your feeding experience as comfortable as possible while you're here.
Okay.
And kind of give you all the good things you need to know.
Great.
We're being a baby-friendly organization. We pride ourselves in really supporting any preference that you have, whether it be breastfeeding or bottle feeding, and we'll provide anything you need to make that successful.
Fantastic.
Yep.
So what about the partners? Do your nurses have words of wisdom for what the dad should kind of pack on their way down?
Hands down, everybody said snacks. I think that's the only thing I have written here was snacks. Any comfort items, of course, or entertainment, headphones, phones, chargers, things that they would need. Same as mom, but snacks. Every dad said he wished he would have brought more snacks.
Can never have enough snacks.
Yeah, not that we don't, we provide, obviously, food items.
Sure.
But
So while we're on that topic,
Yeah.
talk a little bit about what the dads can go find at the hospital food-wise.
Okay. Dads here, we have two coffee shops in the hospital. Both are a little bit of a walk. We will have a gift shop right here in the lobby of our Center for Women and Children's Health, as well a coffee shop, a kind of grab and go for food, and a gift shop, but they aren't open yet.
Okay.
So in the meantime, there are two coffee shops right in the main hospital, as well as Au Bon Pain, as well as cafeteria. So there's 4 options to get beverages and food if needed for dads. We also have vending machines and things like that. For moms or patients, we do have a special menu separately for women and children's. Full meals, snacks, desserts, beverages. Several said they love the cake. Which I've never had, so I can't speak personally, but when you're
will find
here,
out for you,
you
yeah.
can test it out for us. Coffee, things like that. We provide all that. Some trays. We could do a hummus tray. We could do a fruit tray. And we do try to accommodate any dietary restrictions or preferences that you may have while you're here.
Fantastic.
Yep.
So I'm just going to check the comments while we talk a little bit about what the visitor policy is right now, especially while we're still living with COVID, obviously, as we have our masks on.
Favorite topic, as you can imagine. So I'm going to run through the units quickly.
Sure.
Only because you can imagine women and children's visitation is treated a little differently from the rest of the institution for good reason. So our OB emergency area, we do require a screening for COVID, and one support person is allowed in that area. In labor and delivery, we allow 2 support people during your time in labor and delivery. We do screen for COVID in labor and delivery, and we do recommend you're aware that once you're admitted, because although you do not need a negative test, a negative COVID test, or proof of a vaccine for our labor and delivery space, you will need that once admitted into our postpartum unit. So it can be a little bit misleading. You can imagine coming in here surprised to have a baby and you don't have what you need to come in. We're certainly not going to not allow you to have your baby. But
Sure.
Once you're admitted to postpartum, if you have to go to our high-risk department or our antenatal department, we do require a negative test within 72 hours, negative COVID test within 72 hours, or proof of a vaccination.
Okay.
In postpartum, we allow 1 support person per day. We do allow trading out. We really do discourage it though, so obviously we want to decrease the impact of people coming in and out of the building for the safety of the community, the safety of our caregivers, and obviously our patients and babies. In the pediatric department and the neonatal ICU, we do allow 2 support people as well. Both are required to have a negative COVID test within 72 hours or proof of a vaccine, and in those departments, one of the 2 support people needs to be a parent or guardian, of course. No one under the age of 16 is allowed to visit at this time.
Okay. And in terms of proof of vaccination, which we're hoping that all pregnant women are getting that COVID vaccine.
Yes, please.
Just bring your COVID card.
Bring the COVID card with the vaccine, that's fine. As far as, for the vaccine, of course. As far as negative test, you can bring a negative test if you had it at an outside agency. You can also do the at-home test, which we do. We do take. We encourage you to take a picture. You don't have to bring the whole test in, but bring a picture of it would be great.
Great. Now let's talk about paperwork. What paperwork should we bring with us? What do we have to fill out when we get here?
Yeah, not much. We want you to bring your ID. We want you to bring any insurance cards that you have. We will give you papers to fill out when you arrive. You can also go on ChristianaCare.org. We have options to fill out a birth plan. Where it kind of jogs some conversations for you to decide on some decisions before you come in. And you can print that out and bring it with you if you'd like. Also on the website at ChristianaCare.org, when you do visit that site, there's also some on-demand classes, which I'm sure you probably reference online around understanding breastfeeding, understanding birth and labor, understanding a C-section and the process around that, and of course newborn care and any infant safety.
Absolutely, and all of that is available on the website in the women's and children's section.
Yes,
for sure.
We also have a parent education hotline, and that's where you would call to register for any of the on-demand classes. I'm sure we can post the phone number, but it's 301-3360, and any questions can be fielded through that team as well.
So for those who are watching who this will be their first baby, they haven't had a chance to really come into this wonderful building, what do you want them to know about the Center for Women's and Children's Health?
It's beautiful. It's beautiful. We're so proud of this space. There's lots of common areas. Unfortunately, throughout the past 20 months or so, we haven't really been able to use them to exactly how they were designed, but we're getting there. The suites in postpartum are wonderful. We have a pull-down twin bed for any support people that stay, and we encourage the rooming in of families so you can kind of bond as a family before you go home to lots and lots of stressors when you come home with a new baby, of course. We have family rooms. We have tons of handouts and resources, and we're here to take care of you. So I think the bottom line of all of this, of what to pack and what to bring and what not to bring, is you can show up exactly as you are, and you will be perfectly taken care of, and we have absolutely everything that you need here. Maybe not your comfy slippers from home or your cute little take-home outfit, but we have everything that you need here.
Absolutely. Is there anything else the postpartum nurses want us to share today?
No, they really did say less is more.
Okay.
Less is more.
I'll take that.
Yes, less is more. And make sure you take home what you bring, because sometimes it's hard to figure out when you find 3 chargers on the unit who belong, which one belongs to who, and we really try to make sure you get all your belongings when you leave.
Absolutely. Well, thank you so much for all of this
welcome.
information. Off camera, I will have Laurie helping me finish my bag, so that's a perk of the job for sure for me. But if you have any other questions after we wrap up this live, please submit them in the comments, and we can always touch base with Laurie and the amazing postpartum team here at ChristianaCare and get back to you. We'll also be shooting some TikToks later today, so keep an eye out on TikTok and the ChristianaCare page there for some more amazing tips about packing your hospital bag, installing your car seat, and everything postpartum. So thank you so much and have a great day.